First of all, I just want to talk about my advocate's claim. He claims that the United States and its citizens do not have the best health care. Basically, I want to come to a good statement. What country has the best health care? Not every country is perfect, and not every country you can go to has the best health care. But at the same time, at least the United States has one of the best health cares. It might not be number one, like my advocate said, but it's not the lowest or the weakest healthcare program. Yes, it is. However, okay, I have a couple of reasons why I can prove that the United States does have a proficient healthcare. First of all, some reasons why the United States shows that many of our citizens do not have healthcare is because the population grew over time. As you can see, population of the United States, it dramatically grows every single year. According to Devon Herrick, a journalist, he says that the Census Bureau counted that the proportion of people with uninsured or did not have health care in 2006 was less than a decade earlier, which was about 60.2% in 1997. During the past 10 years, the number of people with health care coverage rose nearly 25 million, while the number without health care coverage only increased about 3.5, both increasing basically due to population growth. So with these statistics, you can show that since the population grows, of course, the number of people who have insurance that does not have health care coverage is going to look like, oh, man, what are we going to do? Because you're going to have all these people that are going to be in need. But at the same time, it leads to my other point that there's still a way that you can get proper access to health care. You have many majority proper health care companies such as Blue Shield Association and Blue Shield, just a company in general. According to them, about 14 million people was qualified, both uninsured and insured for health care, did not enroll for it. So what can you do with that? With these statistics, there's no reason why people should not be able to go out there and not receive a decent health care. And at the same time, people who do not enroll in any health care, basically the main reason why they do not want to buy health care coverage because they think that they're healthy and they can live without it for a long period of time, and they want to conserve their money because it is true that the United States does have extensive high bills in either buying medicine or any care that they need for any sickness or for other person's sickness. According to, again, Devon Herrick, a journalist, when people are healthy, like they said, they have little incentive to participate and tend to avoid the coverage as much as possible until they get the need they care. So people do not want to take the time to make sure they cover themselves. So instead, they become naive and just say, oh, no, I don't need the coverage because I'm trying to conserve my money. With this, leading to my advocate's second claim, my advocate claims that there are many misconceptions about universal health care. Well, since he wants to compare the United States health care and think that we should deserve universal health care, he should also know about the warnings about also the flaws and bad causes that come from universal health care. In other countries, such as Canada, of course, number one that you hear about universal health care, people have to wait a long time just to wait to get free health care. Because you know that since you got free health care, you're going to have more people allowed to get health care. So, of course, you're going to have long lines, and people's going to be on waiting lists. According to Rose Grower of the United Healthcare Organization, he says, as a result, in Canada, one woman's cancer got so bad before it really metastasized, means it got worse, before she was allowed to see a doctor. So basically, they had enough ample time just to go see a simple doctor. And with this statistic, you have some cases in Great Britain that you have some patients that are not allowed to see their doctor for simple cases such as tonsillitis. A good example of that I saw was that, I don't have my research over there, but they have patients that die from tonsillitis. So with a simple care or simple problem as that, why should a person have to wait 9 months on a waiting list just to get a simple treatment? And leading from that, as a result from universal health care, there's going to be more taxes that are burdened on other people. So with taxes, people with more suitable health care are reliable to pay for people who do not have the right financials or are not stable with their financials and able to afford health care. So with this is kind of unfair to the people who work hard and get a decent job, even though sometimes it's not, some people have harder trouble than most people, but it's still not fair. You got to pay more taxes on the people that work hard for their money and how to help people that do not have it. Because in some cases, you have people who do not have health care are basically ruining their own health by their own actions that they take. Because you have people who like to smoke, drink, whatnot, and get in trouble. They end up getting cancer or whatnot, or liver poison. So the people with high income have to come in and step it up and help them be responsible for their own health care, even though they just say, oh, this is free Medicare. Also, with this, since if you want to change from private, you want to change from insurance companies such as Blue Shield or whatnot, you still have to transfer everybody's information from one computer database to a centralized database. So with this, you're allowing the government to have more access to all your information, especially from financials to any medical problems that you have. So with the idea with this, people have trouble with this because, of course, you heard of people that have fraud. So some supporters, some people that do not support universal health care do not want to go through any troubles that might can put their Social Security in danger. At the same time, when it comes to the medical field, people do not, since you're not going to have health insurance companies, some people are not going to be, some doctors, there's going to be less jobs and careers in the medical field because there's not going to be no competition. So with no competition, then because the medicine is free and there's no going to be research conducted because the medicine is already there. So with no research, doctors are not going to want to work hard and not get paid for the research if there's not going to be any money in the medical field.
All right, I got to cut you off. You're a minute over.